would like to introduce one of our ongoing projects. The project is about the development of clinical practice guideline of acupuncture for major depressive disorder. And why we want to develop an international guideline about acupuncture for major depressive disorder? Because there are two very important clinical guidelines were published. One is non-pharmacologic versus pharmacologic treatment of adult patients with major depressive disorder, a clinical practice guideline from the American College of Physicians. In this guideline, so the recommendation about acupuncture is low quality evidence from 2 trials showed no difference in treatment response when comparing fluoxetine with acupuncture monotherapy for patients with MDD after 6 weeks of treatment. As we know, there are a lot of clinical researches focusing on the effect of acupuncture on major depressive disorder. But in this guideline, maybe we think they haven't included some Chinese papers. And another important guideline was also published in 2016. It's the Canadian Network for Mood and Anxiety Treatments. This guideline is also focused on the management of major depressive disorder. In this guideline, the acupuncture is recommended as a third-line treatment with level 2 evidence in the adjunctive treatment of mild to moderate MDD. And this table showed several treatments, several therapies for MDD. For example, the exercise was recommended as the first line and second line, but also yoga was also recommended as second line treatment for mild to moderate MDD. But for acupuncture, it was recommended as third line methods. So we think acupuncture therapy is widely used in the treatment of depression, but the value of acupuncture haven't been recognized. And then we want to organize this project. The objective of this project is to formulate guidelines on acupuncture therapy for depression by grade system and methods. And this project was funded by the Ministry of Science and Technology of China. And this project was also organized by the World Federation of Acupuncture Societies. And first, we set up an expert panel and review team. For the expert panel, we have invited several experts to join us, and there are totally 14 Chinese experts and several foreign experts. And the experts are psychologists, and they are also psychiatrists and also acupuncturists. In the expert panel, 2 patients was also included in the expert panel. And at the same time, we set up a systematic review team. In the systematic team, there are 4 graduated students do the systematic review. And we also invited Madison Zhang. She comes from Canada, and she's a methodologist. So here shows all the expert panel and our systematic review team members. And then to develop a clinical guideline, usually it included 3 steps. One is to formulate PICO question, and the second one is to make a systematic review, and the third one is to make recommendation for the CPG. The anatomy of PICO questions, usually it included P means patients, I means interventions, and C means comparison, and O means outcomes. For example, for patients, usually we will think about condition, disease, age, sex, and settings, and etc. In this guideline, we have discussed about what kind of patients should be included in this guideline. So for depression, we use the diagnosis and classification are based on the DSM-5 and ICD-11 and refer to the depression topic on the National Institute of Mental Health website. Usually, depression included several types. The first one is major depressive disorder, and this type is the main popular type of depression. And there are also some other depression, for example, the persistent depressive disorder and premenstrual dysphoric disorder and other types. But in this guideline, we just focused on the major depressive disorder. And there are also some subgroup of depression. First level is according to the severity. It was divided into mild and moderate and severe depressive episode without psychotic symptoms and severe depressive episode with psychotic symptoms. But consider of acupuncture's effect. We think maybe acupuncture is more useful for mild and moderate depression. Then in this guideline, we only included mild and moderate MDD. And besides, according to the ages, it usually was divided into children and adolescents and young adults and menopause and older adults. But in this guideline, we focused on the adults. Then according to the disease caused depression, usually there are depression after stroke, Parkinson's disease with depression, and etc. But in this guideline, we think we just want to focus on major depressive disorder. So we haven't included this depression which caused by some chronic disease. And usually the timing of intervention was a very important clinical question. And usually the depression was divided into 3 stages. One is acute, and the second stage is continuation, and the third stage is maintenance. So a lot of doctors want to know which stage should acupuncture be used in. And then after this discussion, we think that we doesn't need to discuss which stage should be included in this guideline, and which means every stage we can use acupuncture. So we haven't classified the stage details in our guideline. And the second one is intervention. So intervention in our guideline, we describe acupuncture as we use the definition of acupuncture from WHO. The acupuncture literally means to puncture with a needle. However, the application of needles is often used in combination with moxibustion and may also involve the application of other kinds of stimulation to certain points. Then in this guideline, we use not only the filiform acupuncture, but also moxibustion, scalp acupuncture, and electroacupuncture, and so on. For comparison, in this guideline, we select the comparison as one is non-pharmacology treatment, which included exercise and psychotherapy, because this 2 treatment was recognized as effective treatments. And another comparison is pharmacology treatment. For the outcomes, we confirm that which outcomes was critical and which outcomes were important for each PICO question. And here shows the critical and important outcomes for PICO 5. So, for example, the severity of depression and the total number of severe adverse events and response of depression was regarded as the critical outcomes, which means these outcomes are very important. And we regarded quality of life and insomnia and change in use of medication or use of other support systems was important outcomes. Then after discussion, after several meetings, we have formulated the PICO question. In this guideline, there are totally 10 PICO questions. So first level, we want to compare acupuncture with other non-pharmacologic treatment. Then we formulate PICO 1 and PICO 2, which acupuncture compare with exercise, and PICO 2 is compared with exercise. The PICO 1 is compared with psychotherapy. And the second level is we want to compare acupuncture with other pharmacology treatments. Then we formulate the PICO question 3. So for adult patients diagnosed with mild or moderate MDD, should we recommend acupuncture alone, acupuncture plus moxibustion, or antidepressants? And based on the PICO question 3, we want to answer whether add-on treatment is better than the single treatments. Then the PICO 4 question is acupuncture therapy compared with acupuncture therapy plus antidepressants. And the PICO 5 question is acupuncture therapy plus antidepressants or antidepressants alone. And after that, we also want to answer the question that what's the impact of the location and types of acupuncture? Then for this question, we formulate PICO 6, PICO 7, PICO 8. Then the PICO 6 question is compared with body acupuncture and scalp acupuncture. The PICO 7 question compared with body acupuncture and auricular acupuncture. And the PICO 8 question compared with electroacupuncture and manual acupuncture. And for the last level, we want to answer that what's the impact of the duration and frequency of acupuncture therapies. Then the PICO 9 question is, should we recommend treating patients once a week or twice a week? And the PICO 10 question is, should we we will compare the standard treatment duration, which means less than 4 weeks, and extended treatment duration, which means more than 4 weeks. Here, this slide showed all the PICO 10 questions. And then next, we make the systematic review. Here is the Prisma table. Then totally we included 101 RCTs in the meta-analysis. So here shows every PICO questions, how many RCTs was included, meet the criteria of the PICO question. And then we also magnitude of the effect of each outcomes. For example, the severity of depression at the end of the treatment. We after discussion, and we also find some researches, then we think that the mean difference of Hamilton 17, so less than 4 is the trivial effect. And from 4 to 6, it's a small effect. And from 6 to 12 is the moderate effect, and more than 12 is the large effect. For every outcome, we have divided into 12 small effect, moderate effect, and large effect. And here shows the summary of findings. For every PICO question, we make the summary of findings. For example, for this PICO 5 question, there are totally 27 RCTs, and for the outcome of the severity of depression at the end treatment, and we evaluate the quality of evidence, and we also summarize the effect. And at last, we have organized several meetings to discuss about how to make the recommendation. And to make the recommendation, we consider of the desirable effects and undesirable effects, the certainty of evidence, values, balance of effects, resource required, certainty of evidence, of required resources, and cost effectiveness, and equity, acceptability, feasibility. Then after that, we summarize all these items and make the recommendation. Here shows the ETD table. And then here is the final recommendation. For PICO 1 and PICO 2, we haven't made recommendation. And one is because the PICO 1 only one RCTs, and for PICO 2 there are no direct evidence, so we cannot make recommendation. But for PICO 3 and PICO 4, this slide shows the recommendation. So for PICO 3, we want to compare with acupuncture and antidepressants. And at last, we suggest using either acupuncture therapy or antidepressants. And there are conditional recommendations with low certainty evidence. And for PICO 4, which means we compare with acupuncture therapy plus antidepressants and acupuncture therapy. Then for this PICO question, we suggest using antidepressants plus electroacupuncture over using electroacupuncture therapy alone. And it's also conditional recommendation with low certainty evidence. And for PICO 4, and we compare with acupuncture therapy plus antidepressants and antidepressants alone. Then for this question, we suggest using acupuncture plus antidepressants or using antidepressants alone. It's also conditional recommendation with low certainty evidence. Then the PICO 4 and PICO 5 means we also recommend the add-on treatment than single treatment alone. For PICO 6, we compare with body acupuncture and scalp acupuncture. We haven't found evidence. And for PICO 7, we compare with auricular therapy or body acupuncture. Then we suggest using either auricular acupuncture or body acupuncture to treat MDD. It's also conditional recommendation with very low certainty evidence. And for PICO 8, we compare with electroacupuncture or manual acupuncture. We suggest using either electroacupuncture or manual acupuncture. And it's also conditional recommendation with very low certainty evidence. And here, this slide shows the timeline of our project. Then now we haven't finished the PICO 9 and PICO 10 recommendation. After that, we will write and make the external review and edit of the guideline, and we want to publish this guideline in September this year. And then thank you for your attention.